When California lawmakers cut billions of dollars from services to try to balance the budget, illustrated by Governor Schwarzenegger in his now famous knife-wielding video clip, critics say they did so at the expense of the state's most vulnerable. People like Guimei Wu and her daughter Brini. The new mother can only work part-time and gets health care assistance from the state. Because of the cuts, thousands of children from low-income families could lose health benefits.
Medical insurance is very expensive, and a doctor visit, like $70 to $100 each visit. So we couldn't pay for that. Just too much for us.
They should not cut the children's benefits.
In May, 71-year-old Hao Tak Lee was laid off from his job as a janitor at the San Francisco Chronicle and lost his health insurance. A local health coalition was trying to get him into the state's Healthy Families program, but now that it's been cut, he's been waitlisted.
The whole family lost health coverage and don't know what to do, so he feels very upset and nervous and anxiety, everything.
With homeless people who have physical or mental health disabilities.
Alice Wong has muscular dystrophy and uses the state's in-home supportive services designed to keep the disabled out of nursing homes. The program was cut by more than $200 million.
I need assistance to get out of bed, to use the restroom, to get dressed and go out in the day. There's nothing wrong with me, intellectually. So a lot of times having this help really allows me to be, an individual in the community. And I have a lot to offer and pretty productive. But without IHSS, it would be very difficult to live the kind of life that I want.
Some student activists who also receive health coverage from the state are gathering signatures and information to try to get the funding back.
I feel like I couldn't really do anything to help them. But now that we have started this campaign, it feels better. We're doing something for them. We're working toward it, and we're really passionate to make it better.
Critics say they understand cuts need to be made, but they say that children, the elderly, and the disabled shouldn't be targeted.
What kind of community and society do we want that we impose multiple cuts on these really financially vulnerable groups? It just makes no human sense. It makes no financial sense.
Some doctors say the cuts will actually increase long-term health care costs paid by taxpayers, since patients cut from programs will likely turn to expensive emergency rooms for care. Haven Daly, The Associated Press, San Francisco.
Bye-bye. Bye-bye. Say bye-bye.